Welcome to the Alumni House on this beautiful, if slightly cold day in Washington, D.C. Thanks to those of you who made it out and to those of you who will eventually watch online, although we are not broadcasting online, but we are recording so that everybody knows. So on behalf of the Georgetown University School of Health, the Department of Global Health, the O'Neill Institute, and the Global Health Initiative, or Institute, actually, sorry, it's now no longer an initiative, now officially an institute, as well as our co-sponsors, the Human Rights Institute, African Studies, the Global Health Institute, the Women's and Gender Studies Institute. Let me welcome you here. So the title of the talk today is The Urgency of Now, or Right to Health in a Polycrisis World. And we are kind of here in Washington, D.C. at a moment when most countries in the world have a constitutional right to health. And yet we're sitting here in Washington, D.C., where, of course, the U.S. does not have a right to health, rather famously does not have a right to health. And there's deep skepticism over the idea of health as a right. And there is also deep skepticism that the idea that multilateralism and rights more broadly have much to contribute right now in what many are calling this polycrisis world, right? We have a context where we see rising nationalism across the world. We see war in almost every continent of the world, and in fact, I think officially now every continent of the world, there is at least a small war and some very large, including, of course, in Europe and Palestine, countries facing massive debt crisis. So that we here sitting again in Washington, it's easy to forget how many governments are struggling with how to pay the basic bills to keep the lights on in governments in countries across the world, and especially low and middle income countries that are deeply struggling about what to do in what is an increasingly unfair and seen as unfair international financial context. And here in the US, we see falling life expectancy and rising, what many would call a crisis of maternal mortality, especially among Black women in the United States. All of this in a context coming out of the COVID-19 pandemic, where it became evident that while viruses may not have discriminatory nature in them, clearly baked into our societies and our political structures and our economic structures are those. That's awesome. Maybe we can just ask if they can pause that. But colleagues, clearly baked into the social and economic structures we're talking about right now. And so there is unquestionably this moment of crisis that is pervading the world, and it is an incredibly hard time to argue that human rights are central to the work that needs to happen in the world, and yet they have to be. And so there are very few voices in the world who are more articulately and more clearly describing this need, this urgency of embracing rights and using rights as tools and as shields, especially for the most marginalized around the world, than Dr. Tlanang Mafokeng. And so Dr. T, as she is known in much of the world, is the United Nations Special Rapporteur on the Right to Health. She is also the chair of the O'Neill Institute Lancet Commission on Racism, Structural Discrimination, and Global Health, housed at the O'Neill Institute, which is tackling directly these questions of how and why is racism embedded in structures that are producing the unequal health outcomes that we're finding today. But in South Africa, she is far better known, despite her many amazing titles, she is far better known as a pioneering doctor and leader in sexual health and rights, and author and personality on radio and places. And you will see why when she talks, because she is far more articulate than I am. So what we're going to do is we're going to invite Dr. T up to speak. We will then have a little conversation where the two of us will start, and we'll invite the audience in for a deeper conversation, and then stick around afterward where we will hear from Katie Gottschalk, the executive director of the O'Neill Institute, and then have some refreshments after. So join me in welcoming Dr. Mafokeng to the stage and to Georgetown.
Thank you very much. And thank you, all of you colleagues, for being here this afternoon. Of course, he did say about drama, so that's a dramatic element. Sorry about that. And of course, I am privileged to be with you this afternoon, this evening, and to share with you some of my perspective from all of the different roles that I embody, that I perform every single day. But right now, I think one of the most important being the United Nations Special Rapporteur on the right of everyone to the highest attainable standard of physical and mental health. And it's a very long title, but I think it was on purpose that it encompasses all of those descriptions that it does. And in this moment of polycrisis in the world, I possibly can't speak about every crisis, but I'm going to try and speak about and make examples that can show the intersectionality of life, the intersectionality of human rights, how human rights are foundational, but how the right to health in particular as a human right is really, really important, and how we can create a life of dignity for all people everywhere. James Baldwin writes an open letter to Angela Davis in November 19 of 1970. And he ends that letter by saying, if we know that we must fight for your life as though it were our own, which it is, and render impossible with our bodies the corridor to the guest chamber. For if they take you in the morning, they will be coming for us that night. And so to talk about health, and the right to health in particular, is to talk about politics, about resistance, and about the right to a decent life, a dignified life, and about, of course, the social context, socioeconomic context that Matt spoke about. The right to the highest attainable standard of physical and mental health was incorporated into legally binding state obligations in the International Covenant on Economic, Social, and Cultural Rights in Article 12. And as we've just celebrated the 75th commemoration of the Universal Declaration of Human Rights, it has become very, very important to understand this right, which has included another 5 co-international human rights treaties, and of course in several regional treaties, conventions, and charters as well. And it has been enshrined in 150 national constitutions around the world. And so, in fact, if we are going to take the claim that the jurisprudence in the US leads the world, we ought to ask which one, if you are still lagging behind on constitutional rights. As affirmed by the Committee on Economic, Social, and Cultural Rights, the right to health must be ensured to all without discrimination based on prohibited grounds. And we know those prohibited grounds include race, gender, class, migratory status. But we also know as well that there is a context of vulnerability. Humans are not inherently vulnerable, but there are situations that are created around us that heighten that vulnerability. And those may be situations such as poverty, irregular migratory status, health status such as HIV, COVID, as an example. And of course, racism as one of the health determinants. And these circumstances have an intention on how one experiences the world, but they have an effect of nullifying or impairing our equal enjoyment or exercise of the right to health. The right to health includes the freedom to control one's health and body, sexual and reproductive health freedom. And I think I want to underline freedom. We often talk about sexual and reproductive health rights, and not enough about the freedom. To be ultimately free is to ultimately be able to self-determine. And that is about a life of dignity. And you ought to listen to people, because you can't describe to one person what dignity is for them. It's a very subjective thing. And what governments, what states should be doing is, of course, ratifying the right to health, ensuring that the international instruments are ratified, that they include and recognize the right to health in their constitution as an independent human right. This is very, very important, because the right to health speaks not just about accessing the right healthcare at the right time, but it also speaks about underlying determinants of health like water, electricity, healthy working environment, healthy planet, but also information and services related to sexual and reproductive health. And so if you are going to exercise the freedoms that you have under the right to health, the state and the government have obligations to create that opportunity for you to make those decisions. We also often talk about medical facilities, commodities, and goods and services in health. How often do we talk about the opportunity to realize? Just that opportunity in itself is a right that the state has an obligation to assist its citizens. And of course, when we're talking about the Universal Health Declaration, the Universal Health Coverage, which is something that is, of course, part of the 2030 agenda, in there contains, references to a right of system of health protection, which is very important because it speaks and illustrates very importantly the equality of opportunity, but also it speaks about the pledge to leave no one behind. And if you know me at all, you know that I don't like, these UN slogans like, leave no one behind. But they are useful and they have a place. And I think if we're intentional about who is that someone, why are they left behind, and being honest that we continue to leave them behind, then I can fully support the slogans. But often we just say them as empty and hollow and they remain just slogans. And so in the quest to try and be a UN expert that speaks and works beyond the slogans, but understanding the vision, right, that guides these slogans and the agenda of the UN, I decided to fulfill my mandate using anti-racist, anti-colonial analysis, but employing intersectional frameworks as I offer solutions forward to envision a world that we can co-create together, using the right to health as that thread that connects all of us. And I advocate for substantive equality, not just equality, because again, equality we've seen, it's not enough. It has to be tangible. It has to be life-changing. It has to be consequential. And in order to achieve health equity and the highest attainable standard of enjoyment of the right to physical and mental health for all, we have to center the rights holders, the citizens, the individuals. So my approach to the right to health, it sounds very un-UN, but it is very much about centering the human, not the policy, not the framework, not the international conventions. And when I speak to a lot of the students in this room that I have had the privilege of seeing in the past years, as legal scholars, I always tell them that you know the law, you are the expert at the law, but you practice that law, and your practice of the law has a direct effect on people. And you ought to pay attention to the people on whom we practice and we use these tools on. In 2022, the world faced multiple complex and global shocks. And coming out of 2020 with the global pandemic, we have seen how the world is both unprepared, not so eager, very critical when it comes to certain things. And I was appointed the special rapporteur during the pandemic. And a few people have said I'm the UN special rapporteur of pandemics. And now I'm of the genocides. So we wait to see what will be the next thing that gets thrown at me. So I feel like I'm always in crisis. I'm always in the urgency of now, and I'm never catching a breath in the ways that I'm meant to be responding. And as a mandate holder. But these are important to understand because they may be complex in terms of their politics, their history, but they're actually quite simple. If we remember that particular principle of human rights centered, people-centered, and dignity of people first, and that everyone everywhere should have the opportunity to realize the right to health. And so we ought to be asking ourselves, how is this decision we're making? How is this implementation? How is this plan? How is this budget decision going to impact the ability of everyone everywhere to have the opportunity to realize the right to health? We've seen different kinds of conflicts, those in Syria, in Sudan, in the occupied Palestinian territories, in Congo, in Yemen, in Ukraine, and the aftershocks, of course, of COVID lockdowns and the health crisis that put us in, coupled with extreme austerity in many economies, and of course, increasing indebtedness of the low-income and middle-income countries, as well as the small developing island states. And these challenges have worsened underlying determinants of health, which are crucial for that opportunity to realize the right to health. So the rapid surge in food prices, in fuel prices, but also the climate crisis have also worsened the impact of austerity, worsened the impact of the COVID pandemic. And while these can be analyzed in very general overall terms around their impact, we know there's a disproportionate impact on populations based on political and social classifications, stratifications, and hierarchy as well. And so what does it look like? What does the world look like in a polycrisis where, on the one hand, we're very eager to declare the world post-COVID? What does it actually mean? What does it mean then to be in a crisis around conflict and how conflicts particularly impacts the right to health? But also criminalization. I think we don't often think about criminalization and legal frameworks and how they may be used as tools to further discriminate, to further make people vulnerable, and to create a situation of crisis, even when the outcomes otherwise would have been different. And so the 3 C's, conflict, criminalization, COVID-19, together have posed a significant challenge that extends beyond the notion of borders or in one country, have a knockdown effect which may not be known for many years to come. In combination, we can study COVID separately very well. We can do the conflict and war stuff very well, and we can do the criminalization element very well. I'm not even adding austerity and economics to that because, right, we don't have enough time, but you can see how it's layered and it's compounded. But there are some similarities. There are some lessons we can look back and learn from. That social instability and health and income inequalities continue to disproportionately impact particular people and exacerbate outcomes. Austerity measures, in fact, are expected to affect 85% of the global population in 2023, rising to 80%. A rise, in 80% from 2021. And so the magnitude of the pandemic has been unprecedented. We know the biological event itself. As a doctor, I understand the virological event of COVID. And of course, the measures that were necessary to contain the virus. But we also know that the political will and the political atmosphere of the world changed and morphed as the pandemic itself changed and morphed. And again, COVID was a clear illustration of the interdependence, the interrelatedness, and the indivisibility of human rights. And the indivisibility for me is really important because on one instances, you had different governments taking on different measures to respond to the emergency. And they were not paying particular attention to the socio-economic impact of those measures. Then you had other governments who understood very well that the health of the healthcare workforce actually is key to ensuring that the entire society comes out of COVID safely. In other countries, there was a lot of maladministration and corruption related to procurement of safe working tools for the healthcare providers themselves. So effective health system responses in policy and in law, and at all times, including in a global pandemic, require access to information for all people, meaningful participation and accountability mechanisms. And I can say in all 3, we didn't do pretty well. Information, I think we saw the biggest wave of disinformation and misinformation. Meaningful participation of civil society and rights holders, 0. Accountability mechanisms, we're still waiting. And so as we go forward, when people are proposing and working extensively and very hard on, for example, mechanisms like the pandemic preparedness, what will accountability look like then? And why did accountability mechanisms we had previously not work? Right? What are we going to embed in this new way in which we have to recognize and rethink and co-vision global health together that will embed the important elements of human rights principles of information, meaningful participation, and accountability? And so as you are legal scholars, why am I saying that? Remember the people whom this work affects, and to what extent are you advocating for the rights holders as you are holding the pen, drafting, legislating, and doing all of the important different things that you do. And what makes this difficult in terms of accountability, just speaking to what Matt was saying earlier, that the US does not recognize the right to health as a constitutional right. It therefore makes it harder, right, to hold them accountable to the international human rights standards and obligations under the right to health framework. You have, for example, the obligation that the state should have a national health policy that is supported by a national budget and how they are actually going to implement the policy. And that they should, in fact, pay attention to the discrimination as well as the disproportionate outcomes in health within the country. Often in many countries, they will tell, I mean, especially at the high level stages at the UN, presenting very superficial global data to say our maternal mortality rate is actually improving. But when you look at the detail of who is actually dying and why are they dying, it's usually indigenous peoples, Black people, women of color, and they are dying from preventable illnesses as well. And when you then talk about medical training, medicine, the kinds of doctors that are being taught, are they also themselves being ready for the kind of world that awaits them? I mean, I was training in 2007, and already then I felt I was not ready for the world that I had to enter into. And so what is our responsibility therefore then as colleagues? And this is why, coming here, for me, it's always such a privilege, being a medic, because I get to do both, right? Show where medicine and the law meets and how it's important, therefore, to continue doing this work of bridging the gap together. What's also important, and I think perhaps because the capital is just right out the door, to talk about international cooperation, in that there is an obligation in international human rights law for states to provide technical support, financial assistance to other states. And when requested, of course, to assist them in meeting the right to health obligations. But it becomes very difficult sometimes where you have, for example, a bill such as the global gag that says if you receive any US federal funding for your project in South Africa, myself as an abortion provider, for example, I cannot work in an HIV clinic that receives those funds, or can advocate for the decriminalization of sex work, for example, and how that creates a friction and a breakdown and a fracturing of the primary healthcare system. But if they don't even recognize their right to health in their own country, how will they recognize it in the way they come up with budgets and strategies and implementation plans elsewhere? And so to be advocating for your own country to recognize and ratify the right to health is a recognition, but it's also a good step in solidarity with other people everywhere, which get that international support from the US government, for example. So people often say, how can we help? We feel like we are so far off from where the impact is, but that's literally what you can do. You are the future legislators. You are the future lawmakers. And it's about understanding in the global context what your dollars mean and what they do. You know the other thing that your dollars are doing, right? That we get there. But also what's key and why the work of the O'Neill Institute and Matt, who is my dear colleague, that they've been doing in terms of, well, at least coming out of COVID and those experiences around intellectual property rights, around the COVID vaccine development. The right to health gives everyone the right to benefit from scientific development. And we saw how that right was completely shattered during the pandemic. It became a right to make as many profits as much as you can and withhold deliberately the intellectual property. Much of it, again, was supported by tax dollars. So when these institutions say, but we did the research, well, we did, but the research was supported and financed, right, in parts and in large parts by tax money. So it's about understanding how to get over all of those rhetoric that impedes access and success. It's also important to talk about, countries in fragile settings, and conflict, of course, and post-conflict situations are very important. And I often talk about humanitarianism. It has become something that we have normalized as a permanent state of being. It's no longer a crisis has happened. We come in, we do the immediate response, and systems are agile and resilient and strong enough, and we are out. Humanitarianism is something that is there to stay in many regions around the world. But even during the pandemic, we know that those situations, those areas in those contexts of protracted conflict and war suffered really the most as well. I think what is important is that without a focused investment in health systems, all of the polycrisis will forever feel daunting. We all need to focus on one piece of the puzzle and do that really well. But also be a good ally and what I call a co-conspirator, because a co-conspirator is someone in action, is someone that's put some skin in the game, right? And therefore you are able to be aware and you are nuanced in how your work can enable open doors and be a brick, right, where other colleagues can build upon. And that's how I've approached my work at the UN. I know that I can't fix all of the right to health crises that exist in the world, but I'm aware that there will be a time when I'm no longer here. And hopefully the people who come can then use 1, 2, 3 mechanisms to build and go forward. And I think it's important, whether you are litigating, whether it doesn't matter what kind of form your work takes, I think you ought to take that, what's the English word for it? The default setting, that you approach, thank you, the approach. That you understand where you are located within the bigger scheme of things. This work has to be personal for you. Unfortunately, for the rights holders it is. So you don't get to be in the space as a person that is coming to solve the problems and being personal about it. It is personal. And I think much like me as a medic, I think as lawyers, you are also taught, distance yourself from the case. Don't get involved. That's great, do that. But remember that these are real people that we are talking about. And in fact, a lot of the rights you will be protecting are directly impacting you as well as a human being. And it's a very difficult position to be oftentimes, but to acknowledge that. I think one crisis right now is that the United Nations is facing a liquidity crisis.
Mm-hmm.
They won't be able to pay salaries past August. Right? We went from having 2 country visits a year to 1. Many reports, many meetings are postponed to 2025. So in a polycrisis world, when we all understand how urgent the issues are, we have put all our baskets in that one system, and you therefore have it not funded. That does not make sense, right? But that is the truth, is that without the focused investment in these multilateral systems that continue to be the only lasting hope for many people, we are already leaving people behind. So we need to change that slogan. Because by 2030, we already know, we don't need to go to 2030 to be like, oh, retrospect, research shows we left people, we know we are already leaving people behind. And I think that's one of the crises, that's one of the urgencies of now, is that I view the practice of medicine, but I view my role as a special rapporteur on the right to health as one of human rights defender. What does it mean, therefore, if I don't have the tools of the mechanism to do the work of human rights defending in this moment of polycrisis? So one element, because I'm a sexual and reproductive health focused doctor, I just want to show you how interlinked, right, the human rights are. But what happens sometimes when systems are stressed and there are urgent needs? You know, we saw with the COVID how sexual and reproductive health services, even though they were classified as essential, barriers at the time such as transportation, such as the mobility bans. You couldn't travel from the state to across the state. There were time limits to how long people could leave the house. Prevented many patients from reaching their clinics. And in many countries, it was only through litigation that particular patients could actually get assisted care. And even though, of course, we have a lot of technology that came out of the pandemic and digital tools, they still were also gender blind. There was also a language barrier there because not all of them were translated into languages that people could understand. But not everyone also could afford a mobile phone of the latest version and get updates as required, like most apps do. And so the ability of people to make those reproductive health choices, to have the freedom to autonomy, was being directly impacted by the COVID-19 pandemic. And while the governments knew this, they still did not make plans. In fact, more resources were moved from those reproductive health centers towards the COVID response, and leaving, of course, a lot of people without STI infection screening, treatment, management, delayed care for abortion services, reproductive cancers. I mean, a lot of the people could not even get their pap smear screening results, right? So what has happened to all those people who required to have a repeat pap smear, or who in fact had atypical cells and needed intervention to prevent cervical cancer? We haven't even done that kind of retrospective, studies to say what has actually been the impact of those kinds of limitations to people's movement. So during the past decade, of course, and way before, but let's limit the time a little bit just to have a focused discussion. There have been multiple and overlapping conflicts, all over the world. Venezuela, Haiti, Yemen, Syria, Afghanistan, Sudan, among others, with far-reaching consequences. We know Russia with the invasion of Ukraine, and how that immediately led to Ukraine unable to produce agricultural products, such as fuel as well, and essential food commodities like sunflower oil and wheat, and how that had an immediate impact on the rest of the world. So whether or not your country was involved in the conflict, the way in which globalization is, everyone had to give a damn about what was happening. But governments gave a damn much faster because their economies were being affected. The voters were complaining about increased prices in fuel. So the things that also make governments act are also very different, because when it's reproductive health rights, and we're like, but we need our rights, we need access to all of those things. It's like, just wait a little bit. You feminists always ask for extra things, be busy with the pandemic, But again, it shows you who's in the leadership position, who's making these decisions. All of it matters. But it's important because with the global production and how everything is set up, it does hamper progress, because we know that malnourishment is a very important element of the right to health and how that gets affected. And we know how fragile, for example, Sahel and Yemen have been in terms of poverty, but more importantly, malnutrition. As of May 2023, a total of 110 million people worldwide have been forcibly displaced. And that's the largest number of people displaced since the World War II. You wouldn't know, because it's like the alarm bells are kind of semi-ringing, but not quite there. That's the largest amount of people displaced since World War II. And often we talk about people who are crossing borders, right? Because of the inherent disdain for migrant people. But there's a lot of internally displaced persons as well, which, because of these political and unfortunately very harmful migration policies, it impacts even internally displaced persons as well. But again, we are not counting the detail of what policy impact looks like, because we are too caught up in building another wall and putting more people in jail. And I myself, I'm not sure much about where I come from, but I come from a place called Kwakwa in Putanichaba in the Free State province of South Africa. And I was 8, 9, 10 years old when I had to learn how to throw stones at military armored vehicles during the brutal apartheid regime at the time. And so a lot of the work that I do is informed by the fact that that is my core memory of childhood. That's where I go when I think childhood. I have to actively think happy things when I think of childhood, but that is the entry. That's where I go first. And that speaks to the enduring personal trauma, but also the intergenerational, physical, and mental impact of racism and structural discrimination and violence. And often we think, that systems and apartheid regimes like what I experienced as a child are just systemic political issues, but they are inherently violent, by nature, whether or not there is active militarization or not, that is literally violent inherently. And so with what is currently happening in Gaza, it has, for me, been one of the toughest times because the trauma was a visceral, physical reaction of reliving a memory that I've been trying to fix and realizing that it's actually it's not gonna go away. It's never gonna go away. And watching in the way that the practice of medicine is under attack globally, whether it's by reversing Roe v. Wade and exposing more doctors and healthcare workers and clinic staff to harassment by people in the streets and leaving them completely exposed. And because they've got no right to health, they can't claim healthy working environments, right, as healthy workers. And in the ways, of course, that we have seen with the destruction and attacks of healthcare workers in Yemen, in Syria, sorry. I spent some time last year getting a briefing from the doctors in Syria about how difficult it is for them to be working when their own colleagues are experiencing enforced disappearances. All in all, to say, there hasn't been a moment in time where the right to health in a situation of war and conflict that has been spared. We often talk about the protection of health facilities, which everyone understands. How often do we think about the people who are the responders? And yet, even now, when people were talking about the journalists who had been killed in Gaza, by the time they reached 100, doctors and nurses had already reached 250. But they are not viewed as human rights defenders in the way that you understand journalists and freedom of speech. And so there is something, for me, very urgent about how we think about healthcare workers, how we position healthcare workers, and how we understand that they are themselves working under bombardment and threats and harassment. They have to receive the patients who have been dismembered, who have had crushing injuries from war. They have to work while they too are starving. So don't think there's starvation in Gaza that's sparing the doctors and the nurses. They are also starving and having to respond as well as doctors and nurses and still worry about their families. And I think there's a particular crisis that for me, and in a moment that we need to put and put a spotlight on the healthcare workers, their own mental health, their physical health, but how much we require of them as fellow citizens. And I've said this a lot, and I'm going to say this because I think many of you may end up working in this space. For many moments, a lot of feminists, right, felt that the grassroots movement building was working, but that we needed more space and more voice in the high-level spaces, which has really been good. And it's been demonstrated by, the Global Her Act in the Senate. It's been demonstrated by the feminist foreign policy, which the European women really brought to light, and it's really happening. One of the frustrating things for me is that we need to remember that we can't come up with tools that continue to protect the cis heteronormative ways of society and of being and of organizing the world. And so we have to be very clear as well, I think, and this is what I absolutely subscribe to, that there's no place for war on earth, that war is incompatible with human dignity, it's incompatible with sustaining thriving communities as well. And that the impact of war on public health heightens, of course, recurrent, but also future health crisis, future economic crisis, social consequences of that, whether it's blast or heat or radiation injuries. The right to health in all its forms, at all its levels, continues to experience formidable challenges. And at a time of war, those become absolutely incompatible with any idea of the dignity of people, the opportunity, equal opportunity of the realization of people, of the right to health for people. And so an end to all forms of violence, including the colonial violence, the apartheid violence, the imperialist violence, must remain the ultimate goal if we are going to end the urgency of now. Because if you track the cause of all of the different polycrises, they will lead you to one thing. And I said this to the UNSG, the PGA, the Human Rights Commission. I said, you only have all these powers. You only have all of these powers. Utilize them. We've read all your amazing statements. Even if you release no other statement right now, the world is not less because you haven't released yet another statement. What are you going to do? What are you going to do? And if you realize that you are a world leader and the moment is beyond you, you need to go. We don't have world leaders we deserve, whether in government, whether in local government, whether in the global world, in institutions, and we do not have the leaders we need for this moment of urgency. And you can tell them I say that. And if you cannot use all available avenues to you and the responsibilities entrusted upon you for prevention, for recourse, for justice, what are you doing? What are you doing? So of course, I mean, a lot of us are exhausted. We face a lot of these challenges simultaneously, and we have a lot of responsibilities to also fulfill simultaneously, including our own lives, including our own families as well. And so it is important to humanize each other and ourselves as we do the work, because it's very easy to just see each other as just instruments or just something to a means to an end. We ought to demand that we too treat each other with respect and dignity, that in doing the work itself, it must be a process itself that is about restoring each other's dignity. This work can never be impersonal. We've tried that, it's not working. And you will find that, and I have this conversation all the time with the funders, and especially now when I'm gonna talk about criminalization, you know, the one to your feminist organizations, but they will give you funds and say, no, but if we give you this funding, then you can't work on this issue, then you can't. It's like, but these are people. You can't separate a person. You know, the person who needs contraception today is the person who may need an abortion tomorrow, is someone who may be in a same-sex relationship, who may very well be a sex worker, who may be using drugs, who may have used drugs, who may become homeless, who's working in a very unsafe working condition. This is the same person. You cannot put people into these little categories and decide which parts of them are worth your dollar when you are actually funding them so you can get a tax cut. So let's talk about that as well, right? And of course there's direct and indirect criminalization, but one thing again that's important, I know that the work of Bonilla has been important on is on the HIV policy lab. And you know, I've spoken a little bit about same-sex intimacy in how that's criminalized. And I always offer that framing of same-sex intimacy because it's more than just about sexual intercourse, right? A lot of people are criminalized because they thought you looked a certain way. They thought you looked like a woman with sex with other women. We thought you were a gay man, and you sometimes you're not even having sex. It's just they think it's imputed upon you. And so when you think about intimacy as a whole, and think of the kinds of societal violence, the violence in the workplace that people are experiencing because of those harmful stereotypes as well, you can see, therefore, then when the state itself criminalizes people for being people, when they criminalize their humanity, they are sponsoring violence. And I always talk about criminalization as state-sponsored violence, especially because when it looks at criminalizing same-sex intimacy, gender identity, particular racial groups or outcomes that are often occurring in particular racial groups. It is a problem. And often in some countries, punishment is with arrest, prosecution, imprisonment, but like even death penalty. I've had to intervene in a few aspects of the special rapporteur where someone is literally prosecuted and their sentence is death penalty for just being who they are. And I know in this room, we know very well the issues around criminalization of HIV status or HIV transmission. Of course, issue around sex work and abortion, but also the use of drugs. And this year in the HRC in June and in the General Assembly in October, I'll be presenting a report on harm reduction approaches to drug policies and responses. And it's important because we need to understand that a lot of the criminalization feeds off existing discrimination and prejudice. And that even if people know their rights, even people are well educated, it means that they live in a society where there are no repercussions, even they have to go to report, right? They're outing themselves first, already immediately as a criminal. If you say, I was in the street and someone stole my bag, they'll be saying, why were you in the street? Right? Oh, you are an outdoor sex worker. Now it becomes about that rather than you were raped or someone took your belongings. So there is that cycle that therefore gets created, whereby therefore, as a citizen, demanding your other rights, this particular part that you are criminalized takes the spotlight. And often people have been jailed for unrelated things simply because people think they're sex workers, people think they use drugs. Criminalization is a crisis, but also we need to think about the anti-gender movement actors, the discourse around all of that that has emerged in response to national but also global policy developments. This, of course, is not limited to access to abortion, transgender affirming care, or care for individual intersex individuals, or the provision of CSE, for example. We've seen in how even comprehensive sexuality education in schools has been attacked. We saw how critical race theory has been attacked. We've seen how intersectionality is now misappropriated by hashtag say her name in some weird rally somewhere, right? Odd. But that's what happened. People take the language, right, of resistance, of rebellion, of justice, and they use it in very harmful ways to suit their particular agenda. So we ought to be careful, learn and keep learning, and making sure that we understand what we mean by particular terms and mean what we say when we mean them, and very intentional about that. And the anti-gender, anti-rights movements around the world drive policy in a range of national contexts. You have gender studies, for example, in Brazil, in Poland, in Hungary, including in Florida. Discredited, taken off completely the curriculum. And you have parallel efforts, right, in Africa as well, in Western Europe, in Asia, in Latin America, in the Caribbean. And we ought to ask ourselves, are all these things just random and just like completely not connected? I don't think so. I don't think they are. And we also think about the impact of these laws and what they have on the right to health. Discrimination, what we mean direct discrimination, by healthcare workers often looks like refusal of treatment, refusal of making clinic appointments, gross disrespect of patients as well, inferior care, right? You went there, you got the care you got, but that was not the best. I had a hypertensive crisis a month ago and I had to go to 3 ERs before anyone took me seriously. I had to listen to my own heart with my own stethoscope to be like, can somebody believe me in what I'm saying? So this is the problem. And I've had the English and the medical knowledge to explain all of that. What more people who don't, right? So violation of medical privacy is also a big thing. The shaming that happens as well to patients. And often this is when you come in to litigate, when patients have, medical negligence or those kinds of things. But remember, the law often enables these kinds of discriminations to happen. The law enables impunity. And so how do we write that? So if we want the US to ratify the right to health, what should we be embedding in that to ensure that discrimination in practice and in law does not happen? How do we embed accountability? How do we embed redress and justice? So that it's not something that's reserved for those who can access the courts, because we know that the courts are very expensive as well. And I want to wrap up now just to say that if you haven't read it, please read the Roe v. Wade Supreme Court papers. I filed the third-party application there. I think it's a good one, I would say. On showing the right to health, the right to autonomy, freedom, but also tying it very clearly to the right to economic participation, the right to cultural participation, to political civil rights as well, and showing the implications, right, of one particular court's decision, how that can have global implications. Like I said, I mean, there was an fear that what the Supreme Court had decided would replicate everywhere around the world. But we did see a lot of national bans, like rolling bans. But globally, unfortunately, the US is regressing and it's an outlier. They are becoming an outlier in global health, but specifically in gender-related health rights. And we know that by now 16 states have passed laws to codify legal abortion, including for women traveling from other states as well. But the conservative states are closing all avenues, and they're now targeting IVF, right? So you may have thought, I'll never need an abortion, but I don't care about that. But you see that autonomy and freedom to make decisions about your body look very different. And if they can come for your autonomy and freedom on the one, it's very easy. It's just a toss of a coin until it has a ripple effect. I mean, that judgment already stayed. We will actually come for contraceptives as well. We will come for same-sex marriage as well, right? And I think that's where the danger for me is in how we understand the law and its impact in taking away and opening the door for other rights, which may necessarily have nothing to do with the initial case. And I mean, I think the anti-gender coalitions and the movements happening, funded in the global north but operating in the global south is something that we also have to pay attention to. These notions of natural family, traditional family, all of them ideologically are just accompanying colonization and the so-called modernity and civility, right? And we have to understand how this is a problem in terms of the history of European colonial conquest and what neocolonialism looks like today. Again, these are not just impersonal things, these are people's literal lives. And so when you then have people like myself who are fighting for LGBTQA+ rights, abortion rights, same-sex rights, the rights of trans people to get the care they need, for conversion therapy to be banned, for FGM to be banned, for unnecessary medical procedures to be banned on intersex children. They see that as us directly rejecting their family and their founding, ideologies. And they take that very, very seriously because we want to operate outside of the heterosexual male and female binary. And so when we say decolonization, when we say reproductive justice, this is where that comes from. This is where this fits in, because you are in direct conflict, therefore, with what some people term as their traditional family, the soul of society. And therefore, they do everything in their power to protect you because you want to attack their society. You want to mess up with their societal order and hierarchy and this so-called tradition. And then many of us will be called un-African, right? Because of the work. And I often say to people, what is un-African about demanding dignity for everyone? What's un-African about demanding freedom, demanding opportunity to realize the right to health? What's un-African about respecting the next person? That's not un-African. But what we are doing and what we need to realize is that our bodies have always been the background for political ideologies. And so how we respond as well in the time of polycrisis in this time of urgency is not to fundraise the feminist work. Believe it or not, it's a problem. Every 2 years, you still have to explain why the work you do is impactful and why the it's a problem. I'm competing with people who are flying all the ministers in the country to Texas, holidays, bursaries for their children, all of these things, Manhattan apartments. And then they say, no, feminists, we can do it. Come on, let's empower women. You know, women empowerment seminar. I'm like, no, I need money. I don't need more empowerment. Like, that's not it. We empower women, empower to make the decisions, but to be in the driving seat, because we also spend far too much time cleaning up a mess. When will we actually build what we need if we only come in to build, to clean up, right? We can never actually get to the building. So I believe very much that women should lead. And what Martin Luther said, and I'm closing now because I'm going into a little bit of poetry, is that we are now faced with the fact that tomorrow is today. And we are confronted with the fierce urgency of now. In this unfolding conundrum of life and history, there is such a thing as being too late. This is no time for apathy or for complacency. This is the time for vigorous and positive action. And of course, he was saying that in 1963 at Lincoln Memorial in Washington, D.C., in that very famous I Have a Dream speech. And the phrase, the urgency of now, the fierce urgency of now, is just not only old, but it's bold, but it's also prophetic. And it's a call not just for the 1960s, but definitely for today. Actions and expressions that promote transnational unity and solidarity, cooperation are the elements of a strong culture of international solidarity and support, but also in line with the peace and security and human development agenda beyond the UN for all of us in this room, so that all of us everywhere, anywhere, anytime, can have equal opportunity to realize the right to health. And of course, I can't end without talking about Audre Lorde. She said, sometimes we are blessed with being able to choose the time and the arena and the manner of our revolution. But more usually, we must do battle where we are standing. And my question to you is, what battle are you doing from where you are standing? Because you already have power. You already have all the things that you need. What skin are you putting in the game? What is your revolution pinned on? And for millions of people throughout the world, the full enjoyment of the right to the highest attainable standard of physical and mental health remains a distant goal. And in many cases, this goal is becoming even harder to reach due to the many polycrisis that we are facing. The right to health is fundamental if we are going to respond to the urgency of the moment, and as well as to our understanding of our shared human dignity and collective humanity. You do not have to be me in order for us to fight alongside each other, what the Lord said. I do not have to be you to recognize that our wars are the same. What we must do is commit ourselves to some future that can include each other and to work towards that future with the particular strengths of our individual identities. And in order for us to do this, we must allow each other our differences at the same time as we recognize our sameness. Let Black women lead. Queer rights are human rights. Sex work is work. Abortion is healthcare. Peace follows liberation. Ceasefire now. Yours in solidarity and love. Thank you very much.
So just a few things brought up in that speech. Thank you for being here. And thank you so much for challenging this room and the rooms, all of the rooms that you're in to be different and to take seriously these questions of rights and power. So we're going to start with a few questions from me, and then we'll open it up to the audience and have a conversation. So my first question to you is, you're here and you've challenged us with with so many different pieces to think about. One of them that you kind of mentioned in passing is, the kind of pending bankruptcy of the United Nations, right? And I think, this is a moment of a real challenge for the multilateral system. And I think from both kind of left and right, the United Nations finds itself challenged about its relevance and the impact that it can have. And so I wonder, in your work, as you do work with communities around the world, where do you see the future of multilateralism? And do you think it is still relevant today? I mean, increasingly, we see the United Nations Secretary General pushed to the side, right, by other actors. Do you think that signals a real decline of multinationalism? And do you think that there is a way to move it ahead? What are communities saying to you they need from a multilateral system today?
I think for as long as it's standing and it's there, it's needed and it needs to do its work properly. There's no space for mediocrity that's coming out of the UN in the ways that we've seen happen. And I'm happy if you think my work is also mediocre and tell me and I will improve. But we ought to be honest that some of the resolutions and some of the marching orders that come out of there are really not hitting the mark at all. And whether or not the future what will the future look like, I'm not sure, but I will be honest with you. I went in the UN knowing that I could only go there as an independent expert, not as staff per se, right? Because I know I needed the freedom to be able to do and say the things and have the creativity to be able to push in very different political ways, in ways that I know certain parts of the UN cannot. And that's why it was difficult for people and member states when I present my report with this anti-coloniality, anti-racist analysis and framing of the right to health. And it has become quite obvious with COVID and now with all of these wars, what I made, right? And so I think it needs to work because it's here and that's what we have. But is it fit for 2024 going forward? Is the declaration itself that we're just celebrating 75 years of, is that 75-year-old document still speaking to the people and the needs of today and the future? This is what we have to answer. And I don't think the UN is doing enough of the internal inward-facing work for me to feel that I'm comfortable with what the future holds. I'm restless, I'm nervous, but it always pulls through. That is the one thing about it. It always pulls through with rags and everything. It always pulls through. And I think that's what's tiring, is that listen to women, let women lead, let the people who are most affected by the issues we are discussing in the table lead. But they are not, and they don't often listen. They don't quite listen. The participation is there, but it's not consequential enough of rights holders. But I will tell you that for women in the small developing island states, in the so-called global south, for them to do the advocacy work at the national level, they need those high-level policy documents and those resolutions because they can demand their rights and say, look at this, right? They can call out their politicians in terms of corruption or hypocrisy and say, but when you made that statement, this is what you say. How dare you do this here back home? So for people who have no other means of demanding their rights, making sure their rights are realized, we ought to have a system. But I think for me, the restlessness comes that I don't think the system is doing enough work for itself. And it's not honest enough with itself on where it's failing and why it's failing.
What would that look like? So if you were, if following Antonio Guterres, we elect Secretary General Mafokeng. Probably not in the offing, but who knows? But I mean, what would that look like? I mean, because I think this distance between the multilateral system and people has always been there, right? This is not new. And yet somehow I think you're right that there's this growing sense that that is causing a crisis for multilateralism. And we certainly saw in COVID-19 this inability of the multilateral system to force to force equity measures, in part because of just the diffusion of how many players there were and a variety of other things. But what would it look like from where you sit to, to shift that a bit?
Firstly, make a huge boxing ring and get all of the missions and then their permanent representatives and fight it out. They need to like they fight in battles that have nothing to do with us. And I'm like, do you not learn how to self-regulate and self-soothe and like get therapy? Like this is interventional work that should not be making itself public on the platform. Please, And I'm telling you, people take transformational leadership very lightly. And it's very important to also pay attention to personal development. As a leader, the personal element is very, very, very important. I mean, lots of people are doctors, lots of people are lawyers, accountants. That's an expertise. You learn that. But there's a certain level of personal development and a stuntedness that I find emotionally that's missing in a lot of leaders, whether it's parliamentarians, whether it's government, it doesn't matter. And so, of course, including the UN as well. But on a serious note, look, I think there's a lot of work that the UN should be doing regionally. They have a lot of offices. Why is CSW still only ever held in New York? Why is it not in Nairobi? Why are we not doing extensive, meaningful consultations? The other issue of why we talk about coloniality and racism and all of that is that more than half of the people that should be a CSW can't get here because they can't get a US visa, right? If you're a sex worker from South Africa trying to attend CSW to put your agenda on the table, you can't get here, right? So even this idea of travel documents, visas, and the perpetual performance of I'm human enough to come and go, there's something dehumanizing in that, right? And so the UN also, I think, has a part to play in just logistically thinking differently about where they go and where they host some of these. And I think the modalities of participation is also important for the UN itself. The agenda is very packed, rightfully so. But I think they are trying to do too much with very little. And a lot of the other missions are quite small. I mean, it's like 4 people, the entire mission. They can't compete with people of like 50 staff. So it does get quite tough for individual states. But I think as a system as a whole, there are things that can be improved from the modalities of participation, where the consultations happen, and how long we have to. I mean, we can't still be negotiating in 2024 the definition of the family, whether sexual reproductive health rights makes it into the CSW language and the resolution. Even things that we thought we were done with, we are now back negotiating all of those. And so to what level do we really keep opening the same door? Every year we are talking about, sexual reproductive rights, come on, But I do think the boxing ring, first and foremost.
You heard it here first. So talk to me, if you would, a little bit about rights as the correct framework here. So you said at the beginning of your talk a line that I'm going to repeat now again and again and again, right? When you talk about health and rights, you're talking about politics, right? And I think some in the world would today say that the rights framework has outlived its utility. That actually what we need is different frameworks because it no longer serves us in the way in which we want to. And yet here you are, a pretty innovative thinker and leader in this space, arguing that there is space and as a special rapporteur on rights. So why, given the work that you're seeing communities doing, why is it that rights is the right framework versus, say, just move fully into a much more political structure, which some would argue?
And also very commodified private ways of thinking about health, which hasn't helped anybody at all. And one of the examples I can give you is with this universal health coverage. If you just define the word universal health coverage, for me, I think I must be able to get the care I need when I need it, timelessly, right, without any impediments. But when you understand what member states are planning in terms of universal health coverage, they're just creating more space for private actors to create more insurances and administrative layers and more bottlenecks, actually, to be able to access healthcare. And a rights-based approach, for me, in terms of the principles that are important, is that non-discrimination must be a reality in law and in policy, meaningful and consequential participation. The issue of restoration of dignity is very important. We have to have accountability, but accountability requires transparency. That's the other principle. And so the accountability, transparency elements, we've been failing a lot, all of us, globally. In some instances, like we spoke about criminalization and how that heightens discrimination, we understand. Human rights are still what holds us and binds us together as human. There's nothing else that we have to start off with. That is the first strand that what connects us as humans. So we cannot, under any circumstance, let go of that, because then we cease to be human. We cease to be human. And so we have to, and I mean, this is one of the frustrations I have as well with the UN, by the way. There's more space for business actors on UN panels and UN processes, and formal, informal, high level. And so that open space for business in the context of discussions of universal health coverage, as a medical doctor, it's very worrying. And so we have to really fight hard to make sure that business itself understands that they have principles of human rights that they also have responsibility towards. But we have to really demand that health systems and the planning and the stewardship of health systems, first and foremost, comes from a human rights-centered approach, because it's the only system that demands transparency, accountability, redress, recourse when things have gone wrong. We know you're still working on trying to get pharmaceutical companies to be transparent about IP, about vaccines, about even the UN itself. Business does not respect the UN. So it can't be us again in that system who are saying, nah, relax about human rights. That's all we have. That's all we've ever had, actually. And so if we lose that, we've completely we've lost it all. And so we cannot, absolutely, we cannot stop on the human rights, defending, demanding, and making important gains using those principles.
Well, and building off of that, the other piece that you mentioned was these questions around criminalization, right? And we have certainly seen African governments and other governments around the world, more conservative governments, using the kind of Western domination of rights language often as a way to then link anti-gay sentiment with nationalism. How are you trying to navigate that in your work? Because I know this has been front and center in much of what you've dealt with over the last few years.
They do it so poorly. Like, it's so pedestrian in how they and you can tell. And maybe it's because back in my civil society days, I used to be in the CPD process, the Commission for Population Development at the UN. And I used to do what we called at the time is the feminist opposition monitoring. So way before this then became about LGBTIQ plus rights, now as we see in Ghana, in Uganda, and all of the other countries, it used to be on anti-abortion rights and contraception and all of that. And they're using the exact same language, the exact same framing. If you look at the papers that they are using in the courts in Kenya to litigate one of the providers, it's a copy and paste of the Texas bill. If you look at it, does not matter. Even these ones, by the way, are a copy and paste of what's happening in the more conservative states in the US. And so if you get them in a room, they cannot actually tell you. They cannot explain to you why they are doing the things they are doing, and they can't defend it. And that's what fills me with so much rage, is that you don't even understand what you're doing. You can't explain or defend it. And you have no regard for the people's lives in which are being put at risk. Because we have normalized the fact that public servants at high places can just do what they want and they're not accountable to anybody. And I'm not joking about the scholarships and the penthouses in Manhattan and all of that. I'm not joking. when you see what these people are benefiting from passing and bulldozing forward with these harmful laws, it's despicable. It's completely self-indulgent, self-centered, and it is despicable. And it is about money. I've been to the capital many times with fellow South Africans. They go to the left, I go to the right. We talk, they say, well, there's a genocide in South Africa. I'm fighting the global gag and, getting your senators to support the global gag. In the same time, in the capital. Like, life can't get that more wild. It's like, where are we, And so I think if I also didn't experience those moments, I would absolutely be bewildered. But I've seen it, I've been on Capitol Hill with these people. And South Africa, by the way, if you look at the exit of the international NGOs, and they found new headquarters in East and West Africa, it's because our constitution is watertight. Right? It's watertight. Like, we cannot move an inch. And so they soon realized that as soon as we get the democracy, they thought we are on a high, and we are this, Pan-Africanist and pro-Black and this, and they didn't think we had brains, which unfortunately for them, they realized. But they then just played and did exactly the same tactics in West and East Africa. So the idea of solidarity beyond the borders is very important. I've done a lot of work with feminists in the US saying we didn't know that the global gag does this. We didn't know that it limits this. And it's only when Trump came for the domestic abortion rights, then people were like, oh my God, is this what it looks like? And I said, and then some, right? And then some. And so I had spent many years during Obama, majority in the House, majority in the Senate. We said, make this thing, do it. Pass the Global Gag Act and the unilateral, implementation of the gag. Didn't happen. So when the next politician comes in and the first thing he does is comes after abortion rights. But you see now how it's, and you're not going to vote for him again. That is what is the problem. We have leaders we do not deserve. We have leaders we do not deserve. And it is about money. It's about politics. But politics and money is one thing.
All right, I have one more question for you, and then I'm opening it up to everybody else in here. So please come on in. My last hard question is, on my bingo card of the future 3 years ago, I did not have the feminist, a small set of feminists, or at least folks claiming to be feminists, aligning with the DeSantis camp on anti-trans pieces around the world. And so you've got right now this kind of very interesting space where, and I won't push you too much, but I will comment on the fact that a fellow special rapporteur has been in the world saying that, in fact, that there's a trade-off here between women's rights and the rights of transgender people around the world. And that tension of very similar to the tension that exists on sex work.
Can I
right?
underscore something?
Please.
Disgusting.
So my question to you is mostly just, do you want to talk about that? Because I think this is a really interesting challenge right now. And as somebody that is one of the kind of leading voices right now on intersectional feminism, world that is a little bit on fire, I do think we're seeing a hijacking in a way that's really dangerous. And it is pitting, to some degree, women's groups against LGBTQ groups worldwide. And I just wonder if you've got thoughts on kind of where that goes and what we can do.
Yeah. And I think for me, what's unfortunate is that a lot of the people who then use these frameworks and the incredible frameworks that Black feminists have given us to understand the world, to imagine a world together, they do so with no sense of irony. And it shows you that they genuinely do not understand what the hell they're doing. And firstly, it's unfortunate, but it's very harmful because it means that you are using institutions of human rights to do the violent work of taking away other people's human rights, just simply because you can. Do you understand what I'm saying? It's not like you are basing this on some research and some well thought out ideology that, no, you're doing it simply because you can. And I think that's what's incredibly disappointing. So institutionally, there ought to be ways and mechanisms where you cannot be an international human rights institution and churn out and produce work that's anti-human rights of certain people in the community simply because someone else in the system can do it and claim independence. I mean, if you don't like human rights of all people everywhere, but go from your own institution and do that thing. But you shouldn't be able to do anti-human rights work in a multilateral system that is literally designed
But they would
on
say,
human rights.
that you're missing the point and that there is a tension here. And that they are standing up for the rights of, they wouldn't say the word cis, but they would say they're standing up for the rights of women.
Which women, right? Because if we go by that thinking, even I'm not women enough. I'm black, I'm fat, I'm from Africa. Do you know where I am on the scale of womanhood? So it's the same, the same people who can be transphobic, can be classist, they are racist. It's the same spectrum of the same oppression and discrimination. And so it's not too far-fetched to imagine that it's only a matter of time that a racist report comes out. It's only a matter of time. And if you read very well and you know how patriarchal violence works, right? It's just a tool of colonization. Racism is a tool of colonization, of imperialism, that there is this perfect people and a perfect world order, and everyone who does not fit these perfect orders that we have created and constructed on race, on gender identity, sexual orientation, all of that, they are therefore cast away and they are less than and they deserve less. Those are constructed by people, by humans. And so for me, I think it's very harmful. And I always go back to the definition of what reproductive justice actually means. The ability to make decisions on one's body, the ability to have an abortion or not have an abortion, the ability to have children grow up in sustainable and thriving communities. That definition centers me all the time in my own feminism to think, what business do I have on someone else's autonomy and someone else's body? Lucky for me, I'm a doctor. So in my literal everyday work, I get to affirm people's autonomy based on what decisions they want to make, based on the healthcare they need. And so perhaps even as lawyers, you can ask yourself, how am I in service, right, of that particular vision of justice? And maybe for you, it looks like justice for migrant people. Maybe it looks like, justice for people experiencing homelessness. But what is it that centers your work? Because then you will see very quickly that there is no political, genuine center to the work that they do, except the typical imperialistic colonizing rhetoric that they put. And it's not a coincidence, by the way, that all of this is happening with the rise in anti-gender, with a huge amount of monies that are channeled at all levels of society, including the multilateral system, where you have under the UN ECOSOC status, the civil societies that are getting status that are also known to be anti-rights, right? Where you had, for example, the Coalition of African Lesbians who were blocked by the Africa group from getting the status of ECOSOC. But you've got a group in Africa run by racist apartheid soldiers who have ECOSOC status in the UN. Those are not coincidences, folks. Those are not coincidences. And so the system itself is not, it's exposed as much as every other system. The UN is not any more solid or resilient than any other system. And that's what I was saying worries me, is that I don't think the UN understands for itself, for its own existence, how exposed and fragile they are. And if the agenda of the UN is still the UN Charter, it's still the Universal Declaration of Human Rights, there is no place to pit one human right over the other, over people based on grounds that we know are already, we've already decided. You can't discriminate on age, on class, on gender, sexual orientation. We've decided that. So how are we still churning out reports that say trans women are not women, that sex workers' rights are not, human rights, like we have already decided the grounds that prohibit discrimination. And your resolution, like the resolution that makes my mandate, comes from the Human Rights Council. Human Rights Council. If I don't like human rights, that's fine. I'm not even saying they must like human rights. I'm saying keep your view, but do it elsewhere. This is the Human Rights Council.
On which note, what do you all want to talk about? Yeah, go ahead, back there.
Hi, thanks so much for coming. I think I'm really curious about the right to speak on behalf of others and advocate, in particular in thinking about programmatic health priorities set by institutions. So on one side, I thought it was really great and important that during COVID, Africa CDC was coming up as an institutional voice for the continent. But at the same time, I think in the years after, we continue to see that donors in Geneva and DC and Seattle kind of set metrics and give money that people across the continent are held liable to in their programs. Could you just talk a bit about that, how you see maybe COVID having changed that at all, or yeah, I don't know, I'm just curious about your thoughts on that.
Well, the funding.
Yeah, and just in general, I think the right to set priorities in a country.
It's important because I think the conversation around funding for programming, for movement building, all of that has to drastically change. If we are honestly going to do anything on this anti-gender, anti-human rights movements, like if you need to just focus on that, because that's clearly defined and we can track where all of this is happening. I look at it as reparations. And I think framing it as such changes the power dynamic in the room between me and the potential funder. People like myself do the work, whether there's funding or not. We do the work of ensuring our communities survive, whether they come or not. So if you're going to come, you are going to respect us. Your money will be determined by us in terms of priorities. We will discuss the indicators. We will decide how we report to you. Because another thing is you get a grant for 2 years and every quarter you are stuck losing 2 weeks writing a report, a narrative, proving this. It's like it's a nightmare. So you actually have a 2-year grant, half of it is spent in meetings and reports, right? So when do you actually do the thing? And that takes us away from the actual work. And so I think we've had strategic moments where we just rejected some funding because we were like, we as a group of people, we had to make a particular point which was made. But I do assist a lot in terms of the international philanthropists and those kinds of people, with them understanding the savior complex as well that they need to get rid of, because that also perpetuates a very harmful power dynamic. But also that, honestly, these are reparations. Like, you don't get to hold wealth and then give it to us as, reparations. Come straight, open the check, this is what we need, and that's what's going to happen. But it's difficult when a lot of the funding and the grassroots movements are also tied to some government relationship or some multilateral thing, because then your power to negotiate is impacted by those, right? I mean, right now, with PEPFAR, has it been signed? No.
Well, we just literally last night we got a 1-year extension.
1-year
so
extension.
Good news. 1-year extension.
1-year extension. People don't know where their salaries. They don't know about rent and levies. They don't know about programs for the next commodities, all of that, right? Sometimes to get shipment in takes 6 months.
Yeah.
So how are you going to order for the next? So it's a lot of ripple effects. And I think the conversation around funding in global health, the international financial systems, we wrote a letter with TORS recently, talking about the World Bank and this push for private partnerships, contrary to the WHO declarations, and how polluted a lot of the states are, and a lot of the countries are. But it keeps the cycle of poverty, because once we, and I know my colleagues hate when I say this, but like this, the NGO industry complex, being an NGO is now a thing, like the humanitarianism is a whole business now. We have the NGO business, and we need to get rid of that. Yeah.
Somebody else had a hand. Who else wants to have a hand?
Here.
Go for it, Mark. And then
It's such a
Why
pleasure.
don't we do two? Go ahead.
Okay, I'm Mark Lagon. I'm Chief Policy Officer at an NGO, President of the Global Fight Against AIDS, Tuberculosis, and Malaria. We're lead advocates for the goal. I also teach for the School of Public Service. So I'm reassured that I was not off track in a book I co-edited 10 years ago here at Georgetown on human dignity and the future of global institutions, because it said human dignity needs to be the touchstone of the work of the UN and all institutions, and then it's for the agency of people, it's for recognition of all human beings as valuable and full. But without institutionalization, it won't work. My question is, do you have concerns about going backwards on some things? 2015, we had pretty good civil society contributions to the Sustainable Development Goals. When the new pandemic fund gets created at the World Bank, and it requires people to remind those setting it up that there ought to be civil society seats on the board. There are only two seats on the board, and one of them is reserved for NGOs of the goal.
Yeah.
You were the fractioning of functions as well. Thanks.
And then back there.
Hi, I'm Sophie Keeper. I'm an alum from Georgetown Global Health, and I work more in the conflict settings with global NGOs. I also wanted, first of all, to thank you for your honesty, and as someone who's also very good sometimes with the UN, especially as far as salaries and other things compared to my colleagues, and also just priorities of the visas, et cetera. But I guess my brief question is, I know it's a very big topic, but when we talk about localization, obviously it's a buzzword, it's very complicated. And we all know that, like, my colleagues can't even barely figure out how to apply for a certain system that they're supposed to have access to, or even get certain types of funding, or there's so many restrictions, even though we all talk about like listening to the people and the communities and all this stuff. Or then the same big NGOs still end up coming to the table. I know there's no good answer, but I'm just curious, like, how you see, maybe I'm always so like negative about it, but how do you see that in a more hopeful manner, or do you see that, and what's changed?
Yeah, I mean, one of my biggest things, I suppose I can end that out.
So yeah, go for it. Those two, and then we'll do another round.
Yeah. Remind back in.
Mark. Question on going backwards.
Yes.
On things like
Oh,
civil society.
We're going back. Like, it's so bad. I mean, I was on the train from New York this morning, and I've been in CSW for the past week. And I've never left feeling so deflated that I did this morning. And we are going back, and then we are spending so much time on already things we had agreed on 10 years ago, like you say. So there isn't even an opportunity to move all of us together to discuss things like digital health rights, to discuss implementation, to discuss innovative ideas around climate crisis and resilience of health systems and equitable, funding and international, like, we don't even have space to do that big work of like the future. And I feel like the 2030 agenda, and of course the SG has proposed the Summit for the Future and there's co-chairs to kind of do that whole thing, is an attempt, right, to give some idea that there is hope. But even when those kinds of processes themselves are lacking with meaningful civil society participation, that even when you write, there isn't like a meaningful engagement with the submissions. It really, again, just becomes the vision of member states. Member states with geopolitics, right? We have particular powers. And as you see, the Security Council, how the voting goes, it's not principled, it's not on, right? It's based on other politics that, right? And so it replicates everywhere in the system. And the power, for me, is what's important to understand within the UN itself. It's not exempt from those influences that are imbalanced. And I'm not sure how we're going to tackle that. But one of the biggest things from the COVID-19, from the moment it was declared an emergency, I thought the HIV global response had taught us something, right? And it turns out that we truly do not learn as human beings, in terms of civil organizing, if you think about the coalitions built around generic medicines and the pricing of medicines, the work around prevention, the work around adolescent young girls and women, it has always taken civil society. It was never the UN, it was not the WHO, it was none of those people. It always took the lead of civil society to shift and pull everybody in the right direction. And I think the catastrophic failure of COVID-19 will be because they shut every single door to civil society, every single door to civil society. And I think for me, that's what, if the top 5 failures, that's top 2. You know, and it's something that I advocate for a lot in the spaces that the process I participate in the UN. The issue of civil society participation is very, very important, but it's lacking and it's getting less and less. But business, on the other hand, is getting more and more space. So yeah. And on the issue of funding, now that we're talking about business and all of that,
And localization.
I've been proposing this for a long time. You know, when you do like a implementation plan, project plan, we always have M&E at the end. We need to do M&E first. Let's go monitor, let's research, let's evaluate. Let's learn and come back and be like, did what we think actually change after we did this analysis? Truthfully. And if it's not aligning with what we think, with what our agenda is, it's okay to not go there. But the problem is that with localization, people force communities to change their urgent needs and priorities to meet your funding needs and your priorities that you have set in New York or in Washington based on what, right? Because they are making those decisions based on their reality every day. And a lot of it lies in the underlying determinants of health. And I've often said to funders, you want 1,000 HIV tests every month, right? At some point, you would have tested everyone in that community, right? People have HIV testing fatigue. So you will see the numbers go down. And then what they started to do is say, in order to get a file, everyone has to go via room A. But you know what happens in room A? Apparently it's voluntary counseling and testing for HIV. But if you don't do the voluntary counseling and testing, you don't get an admin file, you don't get your truth extracted. Because people are chasing numbers to prove that the money that was invested is working. Where's the quality care in that? Where's the freedom to truly be autonomous in the decisions you're making? And so those are some of the feedback, you know, that we have seen and that we receive as well, is that even the health workers themselves are just completely fatigued and tired of chasing data and numbers that do not mean much for them. They are okay to chase numbers, but it needs to speak to what is needed. And those numbers must be taken into account. And one of the things that I always advocate for is agile health systems. And we're like, oh, what does that even mean? But like in one example, if we can see the trend of the spending and the outcomes are not quite speaking to each other, we need to be agile enough not to wait for the 5-year grant cycle to review the, you know, and trust is important, because if you don't trust the recipients, if you don't trust the people in the local grassroots levels as fellow colleagues and quite equal, you will not believe them when they say, this is what's happening and this is what, and we need to change course. So I think funders are not quite happy to change course, and they pay so much money for M&E. And I'm like, you're doing so, and they'll do these amazing reports after 5 years. And you're thinking, had you just listened at the end of year 2, you know, so you don't have to learn after the grant cycle. That's an artificially made scenario. We can change. We can learn now. The trend is showing this. This is what the research is saying. These are what the people on the ground are saying. How do we change? And I think that agility to be able to move and change is important, and to show faith, right, in the people who are doing the work. Because remember, they're going to do this work, whether you come or not. They are going to be doing this work. So when we do come, let's not impede, you know, the work that they do. But I think it's important to really do M&E first, and then learn, and then collectively design the project. Don't come with line items and say, here you go. You know, a lot of the people need transport money. They need 2 different types of shoes, because at the river stream, the geography is different. And when they get to the clinic, it's, you know, and it's like, no, but we can't buy clothes for people. But you want us to hire like 30 more nurses. How will they do the work if they themselves are slipping and falling and getting fractures just trying to get to work, you know? So we need to think really deeply about underlying determinants of health, what it takes for the people to do the work to do it, and then think of the targets, the rights holders, the key populations, and what they therefore need in terms of quality care. Often we only think of doctors and nurses as just machines who must just do this, but we're not thinking about them and what they need to be able to do quality care as well. Yeah.
All right, Mel, you have a last question right over here, and then we'll wrap up.
Sure, thanks. Dr. T, thank you. I'm Vinay Saldana, I'm the director of UNAIDS here in Washington, DC. And so let me, on behalf of many of our colleagues and in the UN system, from UN volunteers to undersecretaries general in the office of the SG, really sincerely thank you for the work that you do every day. Because when we're deflated, when we need a moral compass, when we need to get inspired and reminded about where the world is at and the important value added of all the processes that the UN is involved in and trying to steer this machinery in the right direction every day. The tweets, the positions, the amicus briefs that you put out give us daily guidance and reassurance for the work we do. So thank you. A quick question to follow on that. In UNAIDS, we've taken a lot of pride in having kind of a UN cover through the UN General Assembly political declaration for where the world needs to go on HIV every 5 years. And starting in 2000, every 5 years, member states have gone back to the UN General Assembly and adopted by consensus a very ambitious political declaration on this now essentially the plan to end AIDS by 2030. But something very interesting and quite alarming happened 3 years ago when for the first time in the history of the GA, the political declaration was called for a vote. It was always agreed on by consensus. Not surprisingly, it was Russia that called for a vote, and for a number of reasons, including because they didn't want to see, for the first time in the history of any political declaration, explicit language that actually mentions in the operative paragraphs transgender persons and people who sex workers and people who use drugs and men who have sex with men. That's never appeared in operative languages of any political declaration. But I'm interested in your feedback, not only on the fact that that resolution was voted on for the first time in the history of HIV, but now it seems to be par for the course. Every time we go into any negotiations, member states are jockeying to see how to just protect the gains that we've achieved or member states have agreed on by consensus in previous years. And the only way of moving things forward is to break consensus and put the resolutions to a vote. And I'm wondering, both for you as an activist, but also given the very precious role you hold as rapporteur, how do you see the compromise of trying to forge a consensus at the risk of not being able or only hold the line on language that was agreed on 2 years ago or 4 years ago or 10 years ago, versus actually saying, no, if we're going to move forward, we have to move beyond a consensus watered down resolution and go for voting.
It's very difficult. I mean, the negotiations, you can be there for 4 days and 4 nights, literally. So I appreciate how difficult that process is. And I remember how anxious we all were sitting, watching all of this happen with that particular declaration and the voting. I think there's a lot of work that can be done in between, in the lead up to the processes. And again, you know, like the way I was saying, some diplomats know just by default that this is the right position, but they can't quite defend why it's the right position. And I've often done this with a lot of missions, sometimes with their delegations from capital when they come to New York, in Geneva as well. Sometimes I brief parliamentarians in certain groups, like for example, the EU group, and to kind of give them that language and that understanding and that nuance that will arm them better when they get to the negotiations, that they can defend particular things. What often happens is that they know it's correct, but they're not vocal because they're not confident to take the floor to say, this is why this, and this is why we're standing by this. Sometimes, as you know, The regional blocs have a lot of influence on the decisions. And I know for South Africa, historically back in 2016, even when I was just an activist in the UN, that South Africa was also very cautious not to be seen as trying to be too Western and like trying to be like the better African country amongst other conservative countries. So there's like a whole lot of diplomatic, ballroom dancing that happens. And so there is, I think, for me, a need to have the preparatory work and to see how we can draw on different experts to actually bring in to brief a lot of the different, stakeholders who are in charge of the pain. I mean, whoever the chair is often, can lead and hold things together. But it's very, very, very disheartening, I think, at the moment that every single thing tends to. But like, I'll give an example. When I do my interactive dialogue, I could be speaking about the right to food and the right to health, which I did in October. And you know, the member states taking the floor, not engaging with the content of my report, but engaging with the other member states, using it an opportunity to yell at them about, oh, you think you're better at human rights, but look at you with this and this and this. And you sitting there like, can someone talk about my report on food? So there's also that as well, that there is a lot of diplomatic stuff happening that sometimes has nothing to do with UNAIDS or the declaration, but they are performing it in that space to kind of show off their power and their authority, and to propel particular things to other member states. So it's very difficult, and I think we need very, very sharp diplomats who can be supported as well with why is it important. And because some of them, you'll speak to them outside and they'll tell me that, look, Capital said not to vote for this, but I know that's wrong, but I actually couldn't say why. So I couldn't convince them. I couldn't have the conversation to say why. And I think that's often very, very important. Then people ask about, being an airline, localization, how do you listen, right? It's about sitting with people for the sake of talking, for meeting each other, finding each other, so that we can, when we move and when we explain particular things or demand particular things, we actually all understand what it is that we are demanding. And I find that a lot of our diplomats find that they're much more confident when they can actually explain why a certain thing is a certain thing, why it's not un-African to have comprehensive sexuality education. Once they get that, they are much easier to be at CPD to defend, the language. But when they know it's right, but when they can't quite do it, it becomes very difficult. Yeah. But I often do the briefings a lot to different delegations on different matters. Yeah.
Well, and on that note, let me thank you for this giant briefing. And as I turn it over to Katie Gottschalk, the Executive Director of the O'Neill Institute, to give us some final thoughts, let's just thank Dr. Lang for being here. Thank you.
What an amazing conversation and just incredible perspective. So thank you so much for sharing that. As mentioned, I'm Katie Gottschalk. I'm the Executive Director of the O'Neill Institute, for those of you that don't know. The O'Neill Institute has always believed that the law is a fundamental tool for solving critical health problems. We see health law as a frontier for collaborative, international, and rights-based approaches to health and well-being for all. When Matt first mentioned this event to me, I was so excited to bring it to the Georgetown community for obvious reasons you've been experiencing for the past 2 hours. The Institute was particularly happy to support this conversation with Dr. T, as she is one of the co-chairs on the O'Neill Lancet Commission on Racism, Structural Discrimination, and Global Health that Matt mentioned earlier. Racism is embedded in the structures and institutions that drive global health governance and healthcare systems, and the O'Neill Institute is proud to support the commission as it identifies and promotes the implementation of anti-racist actions and strategies. I'd also like to say that events like this don't just happen. I want to thank everyone in the audience for your time. I think it's a particularly important time to be showing up for things. So appreciate your 2 hours and maybe a little more for refreshments afterwards. I want to thank the School of Health and our Joint Center on Global Health Policy and Politics for creating the space for this discussion. I think space is also a particularly important thing right now. A huge thanks to Matt Kavanaugh for organizing and moderating this. And to everyone from both the School of Health and O'Neill from the comms team, to the School of Health staff who made this possible. You guys did a fabulous job. Finally, I want to thank Dr. T for her incredible leadership, vision, and passion. Her tireless work not only improves health around the world, but improves the lives of people who have or are typically left behind. I also want to personally thank you for inspiring me every day to get up and do better. And thank you for those that you inspire everyone. So we are so grateful to have you here. Thank you. We appreciate it. Thanks to everyone for being here. So
Thanks.
there's refreshments.